April 7th of each year marks a celebration of World Health Day. In the context of this day, we aim to create awareness on some important health issues as advanced biology students. You will find short informative videos about maternal and children's healthcare in the following part.
Did you know that approximately 1 in 1,000 births in the US is in individuals with an NTD, and the incidence of this in the UK is about 4 times greater? I'm Anka, and today I will be talking about neural tube defects. Neural tube defects are birth defects of the brain, spine, or spinal cord. They happen in the first month of pregnancy, often before a woman even knows she's pregnant. The symptoms of an NTD vary depending on the specific type of defect, but usually problems include physical problems such as paralysis, urinary and bowel control problems, blindness, deafness, intellectual disability, lack of consciousness, and in very severe cases, death. There are several diagnostic ways. The first way is maternal serum alpha-fetoprotein, which is a screening test that is performed on a pregnant woman's blood at approximately 16 to 18 weeks of pregnancy. The second way is high-resolution ultrasound, which is a safe, non-invasive imaging procedure that uses high-frequency sound waves to assess fetal growth and development. And the third way is amniocentesis, which is a procedure in which the amniotic fluid is removed from the uterus for testing or treatment. There is no cure for neural tube defects, and the nerve damage and loss of function that are present at birth are usually permanent. However, a variety of treatments, such as surgeries, injections, implants, or medications, can sometimes prevent further damage and help with complications. You are at greater risk of having a baby with an NTD if you have obesity, you have poorly controlled diabetes, you take certain anti-seizure medicine, you've already had a baby with an NTD, you or your partner has an NTD, or your partner has had a child with an NTD, or someone in your family has an NTD. Getting enough folic acid, a type of B vitamin, before and during pregnancy can prevent most neural tube defects. Thank you for listening.
Hello everyone. Today I'm going to be talking to you about meningitis. So, what is meningitis? Meningitis is an inflammation of the fluid and membranes surrounding your brain and spinal cord. It could cause fever, seizures, stiff neck, sleepiness, irritability, headaches, sensitivity to light, nausea and vomiting, and altered mental status in a patient. It is diagnosed using a process called spinal tap or lumbar puncture. This process is a doctor taking a sample of your cerebrospinal fluid to check whether there are inflammation in your brain or not. And the treatment of meningitis is separated according to its type. If it's bacterial meningitis, the patient must use antibiotics in order to stop the inflammation. In other types, symptoms are treated to cure the disease. Thank you for listening.
Holoprosencephaly, which is HB in short, is a rare congenital brain malformation resulting from incomplete separation of the brain into two hemispheres. It can be inherited due to some chromosomal abnormalities, but it doesn't have to be. As you can clearly see in the figure, in the allobar form, there is no separation between the right and left halves at all. That's why it is known to be the severest type of HBE. In semilobar HB, at least some separation of the two halves is present. Therefore, it has the intermediate severance. And finally, in the lobar form, most of the brain has separated into right and left sides. Therefore, this type of holoprosencephaly is the least severe one. Approximately 1 of every 250 embryos and 1 of every 16,000 live births are being diagnosed with HB in each year. Of course, there are some severe symptoms of this disease, such as cyclopia, which is one central eye located on the forehead, or proboscis, which refers to tubular nasal structure above the eye, or cleft palate or absent nasal septum, or single maxillary central incisor, or abnormally small absent eyeballs, or deep space between the nose and mouth, and so on and so forth. The diagnosis of holoprosencephaly can be made either during the prenatal period or after birth by using CT scan, MRI scan, and ultrasound. And unfortunately, there is no standard course of treatment for holoprosencephaly, but there are some symptomatic and supportive treatments which are used to overcome the daily difficulties that patients diagnosed with HBE face in both social and physical ways. Thank you.
Hello everybody, today I'm going to be giving you a short overlook to the autism spectrum disorder, which is a developmental disability. that may cause problems in these areas: social communication and interaction, and restricted or repetitive behaviors. So since it's a spectrum, you can be from anywhere to being a high function autistic person to the other end of the spectrum where you would struggle to learn and struggle to interact socially. The symptoms may be ADHD, tiptoeing, sleep problems, depression, ignoring the danger, preferring to play alone, and many, many more. Diagnosis and milestones include some milestones. For example, responding with happy expressions by 6 months and mimicking sounds and facial expressions by 9 months, and many more that can be observed by teachers or parents. And if they're not observed, they should get a closer look with a professional. And early diagnosis is important since behavioral, psychological, and educational therapy can really help with learning life skills necessary to live independently and reducing their challenging behaviors and increasing their strengths and learning social communication language skills. Also, medication could help reduce irritability, aggression, repetitive behavior, hyperactivity, and attention to problems, and anxiety and depression. Thank you for listening. This was a short overlook to the autism spectrum disorder.
Happy World Health Day. Please be aware of the risks and symptoms of these health issues. Do not postpone any checkups or medical appointments because early diagnosis saves lives. And finally, do not forget the greatest wealth is health.